We've all said it. COVID has changed our lives. It's something we've never seen before.
Yeah, I mean, in the shutdown, the lasting impact as adults, it's been trying. But what about our children? Liz Crawford explored the mental health challenges in the next generation.
It can be tough to talk to our kids, harder even to get them to open up. But we need to know, how are they doing and how can we help?
Right off the top, we're following three major stories for you tonight. First, we have a new presumptive positive case of the coronavirus in the Tampa Bay area.
March 2020, the world stopped. No travel, no concerts, no sports. Yet the most impactful of them all for families, don't go to school.
It was so abruptly interrupted and we had no idea how to deal with it. And no one had any idea how to deal with it, so there goes your support system.
Claudia Alvarez was a high school sophomore, starting to think about college and what to do with her future.
The beginning of the pandemic threw me into a spiral because there were so many plans and things that I could no longer execute.
Claudia wanted help with her feelings. She knew this was more than just nerves.
All of that being at a standstill left me feeling worthless and useless and helpless.
She wasn't alone, and the problem is still ongoing.
The next pandemic to hit our shores is mental health. And my fear is that we're now seeing a delayed response with our children.
Natasha Pierre is a mental health educator and executive director of NAMI Hillsborough. Even in the last few weeks, she's seen children in crisis.
The first step that I tell every parent is have a courageous conversation. Have a courageous conversation with your child. Don't be afraid of what you might hear, because you have to be your child's first listening ear.
Last month, the American Academy of Pediatrics declared a national emergency in children's mental health, mainly because of the pandemic. The CDC found that between March and October of 2020, ER visits for mental health emergencies rose 24% in younger children and 31% in kids 12 and older.
This is the opportunity to get help.
And now Hillsborough County Schools tracks their own mental health data, including referrals for further treatment. The district knows the importance of this growing problem.
We have seen quite an uptick. If we look at the first quarter in comparison to last year, we've seen about 5 times more mental health referrals in this first quarter.
Now the 7th largest district in the country is spending $7.5 million on mental health resources.
During the pandemic and after the pandemic, we've seen students come back to school having anxiety.
Claudia says it's honest conversations with her mother and her peers that help her embrace her anxiety.
It's okay to admit that you have a problem that you can't deal with by yourself. That first step is just admitting that your struggle is real and that it's valid.
We want parents to walk away with some tools that you can use right now with your children. Here's a sharper insight from the experts: 3 do's and 3 don'ts. Let's start with what you can do. Repeat back what your child said to start a conversation. For example, I heard you say you hate school. Tell me what's going on with that. Pay attention. If you notice something off, it was meant to be noticed, no matter how small it might be. And try to get out of the house. Have really meaningful conversations on neutral ground, like a park or a trail. Now avoid these few things. Don't tell your child it's in their head or they're stronger than this. Don't avoid talking about grief. The pandemic has caused a lot of death. Have those age-appropriate conversations. Don't blame yourself. Focus on support, not shame.